Today, we're diving into a condition called Familial Adenomatous Polyposis, or FAP for short. We're going to break down what it is, what's happening on a genetic level, and how it's managed, all based on information from leading medical sources. The goal here is to give you a really clear, straightforward overview of what can feel like a complex topic. So, here's how we're going to break this all down. First, we'll cover the basics of what FAP actually is. Then we'll get into the genetics behind it. After that, we'll talk about the crucial role of screening, surgery, and other health things to keep an eye on. And finally, we'll piece it all together to look at what the path forward looks like. All right, first things first, what exactly is familial adenomatous polyposis? Let's get a really clear picture of what we're talking about. So what's the one thing that really defines classic FAP? It's the sheer number of polyps. And we're not talking about just a few, we're literally talking about more than 100 polyps growing inside the colon and rectum. And this whole process usually gets started at a pretty young age. Okay, so here's the more textbook definition, and it really points out two super important things. First, that huge number of polyps, which are also called adenomas. And second, the fact that this is an inherited condition. That genetic link is a massive piece of the puzzle, and we're definitely going to get into that next. Now, you might hear that FAP is rare, and it is, affecting just a small slice of the population. But here's why it's taken so seriously. If it's not managed proactively, the risk of those polyps turning into colorectal cancer is nearly 100%, and often by age 40. That's exactly why understanding it and getting ahead of it is so incredibly important. Okay, so we know what it is, now let's dig into the why. Getting a handle on the genetics is really the key to everything else. How to screen for it, and ultimately how to manage it for the long run. So the big question is, why? Why does the body just start producing hundreds and hundreds of polyps? Well, it actually boils down to a single, tiny instruction in your genetic code that's gone a little haywire. It all comes down to a mutation in a specific gene called the APC gene. Now think of this gene as being like a careful gardener for the lining of your colon. Its main job is to act as a brake, to stop cells from growing and dividing out of control. But in FAP, there's a mutation. The gardener isn't doing its job right, and that's what allows all those polyps to grow completely unchecked. Okay, so where does this faulty gene come from? Is it always passed down? Well, for about 3/4 of people with FAP, yes, it's inherited from a parent. But, and this is really important, for about 25% of people, it's a brand new mutation. It just happens for the very first time in that person with absolutely no family history of the condition. All right, so just knowing that you have the FAP gene, that's the first huge step. But the real power comes from what you do next. It's all about being proactive with screening. This isn't about waiting around for symptoms to show up. It's about staying one step ahead of the game. And this is pretty much what that proactive journey looks like. As you can see, it starts early. We're talking colonoscopies right around puberty to keep a close watch on polyp growth in the large intestine. Then, a bit later, usually around age 25 or 30, screening expands to check the stomach and small intestine with an upper endoscopy, because polyps can grow there too. It really becomes a lifelong commitment to regular checkups to stay on top of everything. But here's the thing. With so many polyps and such an incredibly high cancer risk, just watching them isn't enough. And that brings us to the most significant and really the most important step in managing FAP, preventative surgery. And you don't have to take my word for it. This quote from a major medical textbook really says it all. The whole point of the surgery is to be preventative. It's the #1 way to stop cancer before it even has a chance to develop, and it is remarkably good at doing just that. So when we talk about surgery, there are generally two main options on the table. One approach removes the colon but leaves the rectum behind. Now that requires very careful, lifelong screening of that remaining rectum. The other option is to remove both the colon and the rectum, and then the surgeon creates an internal pouch. This reduces the cancer risk even further, but the final choice really depends on a lot of personal factors. And I really want to stress this. This is not a one-size-fits-all decision. Not at all. It's a deeply personal conversation you'll have with your care team. They're going to look at everything: the number of polyps you have, what the cells look like under a microscope, your age, and maybe most importantly, your own personal preferences and what matters to you for your quality of life. Okay, so after surgery, you might think the journey is mostly over. But remember that APC gene mutation we talked about? Well, it's in every single cell of your body. And that means we also have to think about life beyond the colon. Yep, because that gene affects the whole body, FAP can cause health issues in other places. This can mean polyps in a stomach or the first part of the small intestine, something called desmoid tumors, which are non-cancerous growths, and also a higher risk for other things, like thyroid cancer. This is exactly why having a healthcare team that really understands the whole picture of FAP is so essential for good long-term care. I want to take a second to talk specifically about desmoid tumors, because these are a pretty big deal for about 15% of people with FAP. Now, they are not cancerous, but they can grow very aggressively and cause serious problems just by pressing on organs or blood vessels, especially after abdominal surgery. They need their own special monitoring and management plan. Wow. Okay, we have covered a ton of ground here, right? From what FAP is, to the genetics, to screening, surgery, and everything else. So let's pull it all together and really look at what your path forward can look like. When you boil it all down, the journey with FAP really has these 4 key stages. It all starts with getting that genetic confirmation. From there, it moves into a routine of regular screening. The next huge step is preventative surgery to tackle that main cancer risk. And after that, it's about settling into a new normal of lifelong surveillance to manage all aspects of your health. Look, the key takeaway here, the one thing I really want you to hear is this. Getting an FAP diagnosis can feel, well, it can feel like a lot. It can be overwhelming, but it is absolutely a manageable condition. Knowledge, taking proactive care of yourself, and building a strong partnership with your medical team, those are your most powerful tools. This is a journey, for sure, but every single step you take is a step toward taking control of your health.